had your anniversary in the summer for the seaside resort, the gale forest winds we have outside, but nonetheless, congratulations. And you know, Jeff did an amazing first 10 years, you've done an extraordinary second 10 years, and I know the next 10 years will be even more important. And in many ways, I actually do believe that's the case, that the next 10 years will be more important because the communities are going to become more and more and more important. So I am going to answer your question because I think it's a really important question. It relates to communities and, you know, some of the core business of the Alliance. But it's not just, and this is an issue that we're talking about at our board, it's not just that the majority of people with HIV live in middle-income countries. The majority of poor people live in middle-income countries. About 80% of the world's poor now live in middle-income countries. And there is this tension in development that, and appropriately, that money should be going for the poorest people. That's why we have these problems as countries moving middle income without looking at the fact that so many poor people live in middle income countries. So it's not just HIV, it's actually poverty. And we're actually very concerned about this because we're seeing really awful access problems. If you look at access today, access in low-income countries and access in high-income countries is pretty good. Access in middle-income countries is awful. And you actually start seeing bots trailing off as soon as a country enters into middle-income country status. And that's really worrying. So our idea that we're working with a number of the other organizations, international purchasing organizations, on is how do we have a much more refined stratagem? So instead of these huge jumps, rough jumps, you have a smoothed out course. So you not only look at Gini and GDP, you look at percent of people living in poverty, percent of people with access to vaccines, percent of people with access to basic health services. And so we start to smooth this out. The other point I think is really important is that we tend to lump, because of this existing Gini GDP stuff, all middle income countries, or even low middle income or high middle income, into one category, which is absurd. I mean, Zambia is remarkably different than Brazil. Even within Latin America, I mean, you have income disparity of 3,000 to 15,000 for GDP alone, yet they're paying the same for health commodities if they have 3,000 or 5,000, 15,000 for GDP. I mean, that makes no sense. So we've got to deal with the bigger issue of how in development we look at people and talk about people, not average income, but talking about people, people's access, people's poverty, equity, which I think is a real opportunity and where a lot of the post-2015 is going. Now, what does that have to do with the question you asked? I actually think it's very important because one of the things we're working on, and Sean as vice chair of the strategy committee has been involved with getting this started, and I also want to thank the Alliance for all the great people we've stolen from the Alliance, including a new person starting on Monday, including our two HIV people, Adia and Lee, but also the great contributions your folks have made to so much of our programs, including the great work Sean's done on the committee, but also just representing the communities as Alvaro did for Northern NGOs. But what we're looking at is what's the role of development organizations as countries move along the path of development. And how you deal with a fragile state is fundamentally different than how you deal with a country that can manage everything on its own and everything in between. And as you're moving into middle income country, what is the role of the development organization? And how do you look at that, taking into account all those things we talked about, including the disparities in middle income countries. And as you move along the path of development, the role of a development organization shifts from national support for programs and procurement. And again, we need to be more refined, because in Zambia, even though it's a middle income country, we probably should be supporting significant programmatic drug purchases, national scale of programs. You're not going to do that in an upper middle income country or where there's not a lot of poverty. So then what's your role there? And one of the fundamental roles is to ensuring and catalyzing access to everyone, including key affected populations and people are otherwise left behind. And by the way, this is an issue for the United States and Europe. I mean, look at the response in the United States, where I come from. Huge disparity if you go from Washington, D.C., where the people are left behind. If people who are left behind by society are left behind for HIV and left behind for healthcare, and they are the marginalized people, whether it's inner-city African-American people in the United States, or men who have sex with men, people who inject drugs, sadly in Africa, women, who are not a key affected population, but in a lot of ways the way they are treated by society is not remarkably different. They are left behind. They are not treated as equals. So the role then of organizations is to catalyze that change. I'll give you one example, which is El Salvador. El Salvador came to our, is a middle-income country. For those, not a lot of people spend a lot of time in El Salvador. They have money. I mean, their gross domestic product is probably in the 5,000 range or somewhere around in there. They're not rich, but they've got plenty of money to cover their HIV population. So they came to us asking us to fund drugs for prevention of mother-to-child transmission. And we turned around and said, why on earth would we do that? We're not going to spend money on that. You can pay for that. What we will pay for is programs dedicated to MSM and transgender, because your rates are incredibly high. You have 40–50% infection rates in those populations. They're left behind, beaten up, and we will catalyze that, and we'll work with you as the ministry, but over time you have to pick that up. I mean, that has to become, you can't do it now. We'll support it for now, working with community organizations, but over time you have to pick it up. And to me, that's the long-term pathway. I mean, we can't just fund national programs for MSM and transgenders across Central America either, but we can fund it for a number of years until the change happens, until it's mainstream, but then it has to be picked up. And that's going to be the tricky part. You know, how does that change happen? And it takes it's different than handing out pills. It actually takes a political strategy. It takes working with different organizations. It takes having communities involved. That's why communities are so important. It's the communities that are going to have to drive that change. And it's the same actually in low-income countries to me to get to the people who are most at risk now. But it's a path, and you have to start all along the way. You can't just come to a country when they're a middle-income country and say, oh, all of a sudden we want you to deal with this. You have to start when it's a fragile state in a low-income country dealing with it. And that, to me, is the answer, and that's the solution. Now, it's not easy. We're seeing this in countries today. But El Salvador was a huge win. I mean, the minister changed like that because we worked with UNAIDS, we worked with the communities there and changed them. So there's real hope. But it'll be fits and starts, and there'll be some countries that will move and some countries that won't move. So, you know, we have to do it smart and strategically and differently. And it involves not only a public health strategy, but a political strategy and a social strategy, and that's very complicated.
We will come back a bit of the strategy on middle-income countries in a minute, but James,